Miss Baring, is that you beeping at 4 in the morning? Did that wake you up? I'm sorry, it just gets occluded sometimes.
I was awake.
You were? What's the trouble, sweetheart?
Do not think for a minute that anyone calls me sweetheart. But I allowed it. Oh, I don't know.
You can't sleep?
No, I just keep thinking.
If you do that too much, you can get kind of confused.
I know, I can't figure things out. I'm in a quandary, having these doubts.
What you're doing is very hard.
Hard things are what I like best.
It's not the same. It's like out of your control, isn't it?
I'm scared.
Oh, honey, of course you are.
I
know. It's hard.
I don't feel sure of myself anymore.
And you used to feel sure.
Oh yes, I used to feel sure.
Vivian, it's all right. I know, it hurts. I know. It's all right. Do you want a tissue? It's all right. Vivian, you want a popsicle?
Yes, please.
Okay, I'll be right back.
Thank you. The epithelial cells in my GI tract have been killed by chemo. The cold popsicle feels good. It's something I can digest and it helps me stay hydrated. For your information.
Okay, here you go.
Here.
Sure?
Yeah.
Thanks. When I was a kid, we used to go for these from a truck. The man would come around and ring this bell and we'd all run over. Then we'd sit on the curb and eat our popsicles. Pretty profound, huh?
It sounds nice.
Vivian, there's something we need to talk about that you need to think about.
My cancer's not being cured, is it?
Mm-mm.
They never expected me, did they?
Well, they thought the drugs would make the tumor get smaller, and it has gotten a lot smaller. But the problem is it started in new places too. They've learned a lot for their research. It was the best thing that they can do and that they can give you, the strongest drugs. There just isn't a good treatment for what you have, you know? For advanced ovarian. I'm sorry. They should have explained all of this to you.
I knew.
You did?
I read between the lines.
What you have to think about is your code status. What you want them to do if your heart stops.
Well,
You can be full code, which means that if your heart stops, they call code blue. And code team will come and resuscitate you and take you to intensive care and stabilize you again. Or you can be do not resuscitate. So if your heart stops, well, they'll just let it. You'll be DNR. You can think about it. I wanted to present both the choices before Cleakin and Jason talk to you.
you don't agree about this?
Well, they like to save lives. So anything's okay as long as life continues. It doesn't matter if you're hooked up to a million machines. Cleakin is a great researcher and everything. And the fellows, like Jason, they're really, really smart. It's really an honor for them to work with him. But they always just want to know more.
I always want to know more things. I'm a scholar. Or I was when I had shoes, or even eyebrows.
Well, okay then. You'll be faux code. That's fine.
No, don't complicate the matter.
It's okay. It's up to you.
Let it stop.
Really?
Yeah,
So if your heart stops beating,
just let it stop.
sure?
Yes.
Okay, I'll get Kalikin to give the order and then...
Susie,
Uh-huh.
you're still gonna take care of me, aren't you?
Of course, sweetheart. Don't you worry.
That certainly was a model in display. Popsicles? Sweetheart? I can't believe my life has become so corny. But it can't be helped. I don't see any other way. We're discussing my life and death. Oh, life and death. And not in the abstract either. We're discussing my life and my death. And my brain is dulling, and poor Susie's never been very sharp to begin with. And I can't conceive of any other tone. Now's not the time for verbal swordplay, for unlikely flights of imagination, and wildly shifting perspectives, for metaphysical conceit, for wit. And nothing could be worse than a detailed scholarly analysis, erudition, interpretation, complication. Now is time for simplicity. Now is a time for, dare I say it, kindness. I thought being extremely smart would take care of it, but I see that I've been found out.
I know it's okay. Shh, just try to clear your mind. It's all right. We'll get you a patient-controlled analgesic. It's a little pump, and you just press the little button and you decide how much medication you want. It's very simple and it's up to you.
Dr. Varian, Susie.
Time for a patient-controlled analgesic. The pain is killing her.
Dr. Varian, are you in pain?
Am I in pain? I don't believe this. Yes, I'm in goddamn pain. I have a fever of 101 spiking to 104 and bone metastases in my pelvis and both femurs. There is cancer eating away at my goddamn bones, and I did not know there could be such pain on this earth. Oh God.
I want a morphine drip.
But what about patient-controlled? She'll be more alert.
Ordinarily, yes, but in her case, no.
But
She's earned a rest. Morphine, 10 push now, then start 10 an hour. Dr. Varian, try to relax. We're going to help you through this. Don't worry. Dr. Varian? Excellent.
Hi, how are you feeling today? These are my last coherent lines. I'll have to leave the action up to the professionals. It came so quickly, after taking so long, not even time for a proper conclusion. In death, capital D shall be no more, semicolon. Death, capital D, thou shalt die, exclamation point. I'm sorry.
In the moment, I was focused on keeping Dr. Varian alive. She's been an invaluable source of knowledge for our research and driven it forward in an incredible amount. Besides, I had many other patients that I needed to go see. I couldn't stick around with Dr. Varian all day. I guess, looking back on it, I could have been more responsive to her nurse, Susie I think her name is, and recognized that Dr. Varian was in pain. We could have given her a patient-controlled analgesic to give Dr. Varian more control over her situation, and I could have stayed around to make sure Dr. Varian's pain was being controlled and that she was responding the way that we were hoping that she would.
over the time I've spent taking care of Vivian, I truly feel like I got to know her better than any other doctor that goes in and out. You know, I really, really care for her. I've always tried to make her feel so comfortable by sitting with her and touching her. I learned in my training that a touch has such a better effect than words sometimes. You know, it really goes a long way. I think I did a good job of presenting information about the current options, you know, in a way that she can really understand. But maybe I just didn't give her enough time to emotionally respond before I kept spitting out information. You know, let the paint dry, if you will. Looking back, though, I should have really discussed the options between Code Blue and DNR better. You know, what each procedure entails and whatnot. I should have been more perceptive also to how she was feeling and how much pain she was in. It probably wasn't even a good idea and a good time to bring up the topic in the first place if I saw how much pain she was in. I know she's in pain a lot. I know, and I don't know though. You know, I'm not her, so maybe I should come up with a better response and keep saying I know.
Susie's a great nurse. She really took care of me. Dr. Kalikian, he felt pretty distant whenever he visited me. He was a little far, and I felt more like a research subject more than a patient. When he asked me if I was in pain or not, I was furious. I was obviously in so much pain. He has a medical degree and he couldn't even tell. When the doctors came around, I really did not know what was going on. I wasn't familiar with the words they were using, and I really wish they gave me some time to process the information. I'm so used to being in control, and the longer I'm in treatment, the more I felt like I was completely helpless. I am completely helpless.
Miss Baring, is that you beeping at 4 in the morning? I'm sorry, it just gets occluded sometimes. Did that wake you up?
No, I was awake.
You were? What's the trouble, sweetheart?
Do not think for a minute that anyone calls me sweetheart. But then, I'll allow it. Oh, I don't know.
You can't sleep?
No, I was just thinking.
What's keeping you up? Is there anything I can do to make you more comfortable?
I'm in a quandary, having these doubts.
What you're doing is very hard. Do you want to talk about these doubts?
Hard things are what I like best.
It's not the same. It's out of your control, isn't it?
I'm scared.
Oh, honey, of course you are.
I don't feel sure of myself anymore.
And you used to feel sure. I can't possibly imagine.
I used to feel so sure.
Vivian, it's alright. I'm here. I can see why you're feeling this way. You're not alone. It's alright. Do you want a tissue? Vivian, would you like a popsicle?
Yes, please.
Okay, I'll be right back.
Thank you. The cold popsicle is something, feels good. It's something I can digest and keeps me hydrated. For your information.
Here.
Thank you. Here.
Sure.
Yes.
When I was a kid, we used to get these from a truck. The man would come around and ring his bell and we'd run all over. Then we'd sit on the curb and eat our popsicles. Pretty profound, huh?
That sounds nice.
How are you feeling now? Vivian, there's something we need to talk about. You need to think about. Do you think you're in a good place to talk? It's regarding sensitive information about your course of treatment.
Popsicle feels nice, and yes, I'm alright to talk.
What do you know about your medical situation?
Well, the epithelial cells in my GI tract have been killed by chemo. My cancer's not being cured, is it? They never expected to be, did they?
Well, they thought the drugs would make the tumor get smaller, and it has gotten a lot smaller, but the problem is that it's started in new places too. They've learned a lot from their research. It was the best thing that it was the best thing that they had to give you, the strongest drugs. There just isn't good treatment for what you have yet for advanced ovarian. I'm sorry, they should have explained this.
I knew.
You did.
I read between the lines.
I'm glad to hear that you understand some of what's going to happen. Do you mind if we discuss what happens if your heart stops?
Okay, go on.
What you have to think about is your code status. You can be full code, which means that if your heart stops, they'll call a code blue and the code team will come in and resuscitate you and take you to intensive care unit and you'll be stabilized again. Or you can be a do not resuscitate. So if your heart stops, no team will be called and we call that a DNR. You can think about it, but I just wanted to, present both choices to you. So, in full code,
Well, doctors will do everything they can to prevent me from dying.
and in DNR,
I die. I don't want to complicate the matter.
it's okay. You can take your time to decide, but it's an important matter that you should definitely be thinking about. It's important to know that the decision is up to you.
Let it stop.
Really?
Yes, I want to be DNR.
So if your heart stops beating,
Just let it stop.
sure?
Yes.
Okay, I'll get Kalikin to give the order in and then,
Susie,
uh-huh.
you're still going to take care of me, right?
Of course, sweetheart, don't you worry.
Oh God.
Shh, shh, shh. I paged Kalikin, up here. He'll get you some meds.
Oh God, so painful, so much pain.
I know. Shh, just try to clear your mind, okay? I'm not going anywhere. To manage your pain, we're gonna get you a patient-controlled analgesic. It's a little pump, and you can push a little button and you decide how much medication you want. It's very simple and it's up to you.
Yes, please.
Dr. Barron, Susie.
Time for a patient-controlled analgesic. The pain is killing her.
Dr. Barron, I see you're in great pain. We'll give you a patient-controlled analgesic, but in the meantime, I would like to give you some morphine to help.
Oh God, yes.
Morphine, 10 push now. I'll put in an order for a patient-controlled analgesic.
Got it.
Dr. Barron, try to relax. We're gonna help you through this, don't worry. Dr. Barron, I know it must be so hard to be in pain like that. We're gonna give you some medicine to make you feel a bit better. Then once we get you that pump, you'll be able to decide how much morphine you want so you can be more in control of your pain as it comes. Susie will be here to help anytime, and I'll come back very soon to check on you, okay?
Thank you.